Can Juvederm still be there after 4 years of waiting for it to dissolve? 4 years ago, I had Juvederm injections in the nasolabial lines. 2 syringes later, the lines were filled out, but I looked like a monkey, my face totally blown out. I was horribly bruised around my mouth, but decided to accept my stupidity and wait it out, believing it would all be absorbed within 9 months. 4 years later, the sides of my mouth still looked blown out in areas where I was badly bruised. Could this still be filler after all this time? And could hyaluronidase be a solution?
Thank you for your question. You stated in your question that you had undergone Juvederm injection for the nasolabial folds 4 years prior, and that apparently you had gotten very bruised and you regretted making this choice and you were waiting for the material to go away, and now you state that 4 years later there's still an elevation and you're asking if the material is still there and would hyaluronidase be of value. Well, I can certainly give you my perspective. I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic reconstructive surgeon, and practicing in Manhattan and Long Island for over 20 years. I use a lot of Juvederm and Juvederm Voluma and other fillers in my practice, and I think that there is an opportunity for you to maybe not only understand a little bit of the philosophy that I come with in terms of my perspective on patient management of nasolabial folds and my experience using this material and having patients come to me for second opinions and revision. So let's begin with this concept of the longevity of fillers. Fillers, when estimates are provided as to the longevity of a filler, there's a certain direct correlation with the relative thickness or viscosity of a filler. The thicker the filler, the longer it tends to last. And however, most of these estimates are based on placement at a certain level of the skin, and from actual clinical experience, I've seen a wide range of time frames. There are people who go through the injectable filler really fast, and this is basically we're staying on the specific area of hyaluronic acid fillers, which Juvederm is part of. And there are people who have had it for years with similar stories like yourself. And I could say that there is my theory, or a theory that we all, many of us share, is that the material, being a foreign material, even though it's well tolerated and doesn't require skin testing before being placed, can become encapsulated, almost the way, in some ways comparable to the way a chin implant or a cheek implant or a breast implant becomes encapsulated. The body can form a capsule around the material, which then prevents it from being broken down. So in situations like this, where there is a question, I do use hyaluronidase, and I would use hyaluronidase in a situation like yours. I think it's worth trying because the relative risk is low, and you may actually finally get back to your normal anatomy. We have patients who have had a hyaluronic acid filler in their face, and I've actually seen them for several weeks to months at a time, and I've injected hyaluronidase because the material had gone to very different levels of their skin, and they'd come back and say, you know, I think there's still a little bit of this stuff still left here, there, somewhere else in their face, and they were almost always right. So I would also suggest that you, in terms of your disappointment with the choice of the nasolabial fold, you have to understand that a lot of times the standard philosophy about facial aging and treatment has been, I think, stressing too much the chasing of lines. And the nasolabial fold is often a central focus, or the parentheses lines as it is often called. The challenge is that the fold is, in a way, looks deep relative to the rest of the face, where there is also probably age-related volume loss. We do a procedure where we actually structurally restore volume in the face using traditional hyaluronic acid fillers at the level of the cheekbone, the jawbone, and the chin in a way that restores volume. And the fascinating thing is I can do this and actually not put anything in the nasolabial fold. And although the depth will remain the same, once everything else is in proportion, things look very, very good. So I think that in our experience, it's not about chasing lines. Yes, there are places where there is value in softening lines, but in terms of the nasolabial fold, I've basically kind of shifted a lot towards the restoration of surrounding volume. And even if we do place in the nasolabial fold, being very conservative, because it's not, you can imagine that, or you can look and see that younger people can have these deep nasolabial folds, but they don't necessarily look older. There's a lot more to facial aging than just the depth of these folds. So as far as actionable decisions, I would suggest that you find a doctor you're comfortable with a lot of experience with hyaluronidase, see what can happen in terms of dissolving the material. Hopefully it'll dissolve, and if it's not dissolving, then it might be residual tissue growth from just the response to maybe the bruise or something like that. But again, that requires physical examination and clinical determination by a qualified physician. So I hope that was helpful. I wish you the best of luck, and thank you for your question.